This video is in regards to the HCC indicator in Allscripts. HCC stands for Hierarchical Condition Category, and it measures the disease burden for patients by assigning a value to some chronic conditions. For example, uncomplicated diabetes has a lower HCC score than diabetes that is complicated by a renal manifestation. HCCs must be assessed at least once per calendar year. As a reminder, providers should assess diagnoses for all documented conditions that exist at the time of the visit and affect the patient's evaluation, care, treatment, or management. Accuracy and specificity of the assessed diagnoses will help us be successful in reporting of our patient's illness burden. Let's look at an example of a patient. This patient presents with a UTI and also has stage 4 diabetic kidney disease and major depression. So let's add these diagnoses to the problem list. First, we'll start off by adding UTI, then diabetic kidney disease, when you see a plus sign like this, you want to open that up and expand so you can see the full list of all diagnoses. The one with the plus sign is unspecified, so you want to find the one that is most specified and reflects the disease that the patient has. Next, we'll add depression. When you search for depression, you'll notice that the first option that pulls up does not have an HCC indicator next to it. Others do. So if the unspecified depression is applicable, you would go ahead and click on that one. However, if another one of these is an option that applies, you would want to click on that one instead. So we're going to pick the mild recurrent. Now you'll notice that the HCC indicators in the active problem list are red. This means they have not yet been assessed in this calendar year. So to assess those, we want to click on this button, and then you'll see that the HCC indicator has turned gray and it has a green check mark on it. So again, that means this diagnosis has been assessed. As a recap, what can you do as a provider to impact our overall risk score? Make sure that you verify the patient's active problem list is accurate, complete, and specific. And when documenting your visit with the patient, assess and document all conditions that exist at the time of the visit and affect the patient's evaluation, care, treatment, or management. Be sure to assess all chronic conditions at least once per year to ensure that they are properly being monitored. If you have any questions, please contact Tanya in coding at extension 8702.